Hi, I'm Kristen Stiegler, and I'm the Senior Project Coordinator with the Center for Health Workforce Studies at the University of Albany. I would like to present a poster titled Trends in Nurse Practitioner Diversity in New York State. Our research examined the racial and ethnic composition of nurse practitioners, their age of graduation, and their distribution in New York's health workforce. We also identified the characteristics associated with working in a primary care health professional shortage area, also known as a HIPSA. In many regions of the state, both Hispanic and Black MPs were underrepresented compared to their presence in the regional population. Hispanic MPs were underrepresented in most regions. New York City accounted for the largest disparity between Hispanic MPs and the local Hispanic population. We also found that Black MPs were largely underrepresented around the state, with a few exceptions. Long Island, for example, had a higher percentage of Black MPs than the local Black population. Overall, younger MPs were racially or ethnically diverse. Among younger MPs, 13% were Black and about 7% were Hispanic. On the other hand, among older MPs, Blacks accounted for less than 11%, and all other underrepresented groups accounted for less than 4% each. Black and Hispanic MPs graduate from their MP programs at older ages than other MPs. Our research showed that higher percentages of Black or Hispanic MPs graduating after the age of 30. Also, over 3/4 of MPs who identified as another race or two more races graduated after the age of 30. Finally, we found that nearly half of Black MPs and over 40% of Hispanic MPs work in primary care HIPSAs. Black MPs were 2 times more likely to work in primary care HIPSAs, and Hispanic MPs were 81% more likely to work in primary care HIPSAs compared to white MPs. In recent years, diversifying the MP workforce has made some progress, as Black MPs in the workforce is close to the percentage of the statewide Black population. Yet there is room for further improvement. As we consider the needs of our diversifying population, health equity, a culturally competent health workforce, and reducing health disparities requires an understanding of the diversity and distribution of the workforce. It is important to look at all angles of the health workforce, as well as to analyze racial and ethnic groups individually to really understand distinctions in the regional workforce and the needs of the local population. Thank you.